I beg to move that this House has considered inequalities faced by women in the North, and it's a pleasure to serve under your chairmanship, Mr. Cho. This debate is about the Women of the North report published in September this year by Health Equity North. And I'd like to thank Health Equity North for the report, their support for today's debate, as well as all those who have contributed to this vital research that I'll be discussing. Chair, women in the north of England face unequal challenges and inequalities in their lives and their health and compared to the rest of the country. They're more likely to work more hours for less pay and be in worse health. They're also more likely to be an unpaid carer, live in poverty and have fewer qualifications. In fact, the inequality between women living in the north of England and those in the rest of the country has grown over the past decade. It's harmed women's quality of life and work, and it's harmed their communities and families. So today I'm going to debate the key findings of the research and then highlight the recommendations of the report. And the report doesn't make for easy reading, Chair. And even though the Minister, like me, will be all too aware of the impact of austerity on our communities, many of the findings will, I'm sure, come as a shock, as it did for me. And I won't be able to cover everything, but I hope this debate can begin a dialogue between the Department and the contributors of this important intervention. I will give way.
I commend the Honourable Leader Durham for bringing this forward, and I spoke to her before the debate commenced. There's an abnormality, first of all, between self-employed men. 2.5 times more self-employed men have jobs and opportunities than women, and women have the skills and the talent. But one of the things that holds women back is childcare. It doesn't matter where you are in this great United Kingdom, Great Britain and Northern Ireland. If you haven't got childcare, you've got nothing. You can't get the opportunity. Last week in the TV it said that the childcare for some families is as much as a mortgage. That's a massive issue.
Thank you for that intervention, and I couldn't agree more, and that's why I'm pleased that the Labour government will be bringing in thousands of new nursery places and breakfast clubs, so hopefully that can alleviate some of the problem there. But childcare is an issue not just in the north of England, but I know as well in the north of Ireland. So I'm going to start with employment. Employment rates for women in the north are lower than the national average of 72.2%. In my region, the North East, it's just under 70%. In Yorkshire and the Humber, it's just over 70%. And in the Minister's region, the North West, it's just over 71%. Disability and long-term sickness is a major issue in the north. All northern regions have higher levels of disability and long-term sickness compared to the national average, and considerably higher than the South East. The report states that the estimated economic cost of this is around 0.4 billion per annum. Compounding this is the fact that the median weekly wage for women in the north is below the national average in both full-time and part-time employment. For instance, the average weekly wage for a full-time working woman in the North East is £569. This is much lower than the national average of £625 and considerably lower than women in London at £757. Overall, women in the north could be losing out on around £132 million a week. In terms of education, the number of women without qualifications is higher in the north than it is in the south, and it's higher than in the south east. Now, this leads on to the next point, which is women and poverty, which itself could be its own debate. In the north, we have a higher percentage of families on universal credit compared to regions in the south. In fact, the average number of families on universal credit across the north is 3% higher than the south, and it's even higher if London is excluded. And all 12 local authorities in the North East have rates of absolute child poverty above the English average. By contrast, all 30 local authorities in the South West have rates of absolute child poverty below the English average. The North is also the region of unpaid care, with 12% of women in the North East providing it, just under 2% higher than the national average. Health Equity North estimates that women in the North are providing around £10 billion a year in unpaid care. They also estimate, harrowingly, that in the last decade, the life expectancy of girls born in the north of England has begun to stall and in some cases decrease. In addition, girls born in the north will not live as long in good health compared to the national average. And for older women, we know that menopause is often cited as a potential driver of change in women's health. And this makes it all the more concerning that there are regional differences in levels of hormone replacement therapy, with lower levels of HRT being prescribed in the north of England. And the picture is even more bleak when we consider pregnancy and reproductive health. We've seen the biggest increase in abortion rates between 2012 and 2021, and there's been a demonstrable relationship between austerity and the implementation of the Tory two-child limit and the increased rate of abortions. And I should also add that the two-child limit itself affects over 1 million children in the country, and over 60,000 babies, children and young people are impacted by it in the North East alone. Right now, over 25% of pregnant women in the north of England are living in the most deprived 10% areas, with 40% of pregnant women living in the top 20% most destitute areas. So tragically, stillbirths are the highest in the most deprived communities and highest among Black, African and Caribbean women living in the areas of greatest deprivation. Also, women living in poverty are at increased risk of death and depression. Subsequently, babies are at a higher risk of stillbirth, neonatal death, preterm delivery and low birth weight. And I also want to touch on smoking and pregnancy, which the report also refers to. And I'm glad to see that the smoking bill will receive its first reading today. Yeah. And it would be good to hear from the Minister whether the government will continue to fund financial incentive scheme for pregnant smokers. Women in the north of England also have the highest rates of domestic violence abuse in the country, something that many children are exposed to. This too deserves its own debate. And when we consider mental health, the report highlights that in a cohort of over 1 million women aged between 16 to 65, from 2000 to 2018, the prevalence of mental illness was higher in 3 northern regions compared to the south of England, with severe mental illness such as bipolar disorder and schizophrenia. The North West and the North have higher prevalence rates. Lastly, the report covers the reality of marginalised women in the North. This covers a range of areas from criminal justice to education and health, as well as issues related to homelessness and substance abuse. And I don't have enough time to go into each point, but I would encourage the Minister to read this section if he hasn't already, and I will either write to the Minister about these or table written questions. Coming to the recommendations of the report, I know these are across multiple departmental areas, so the Minister may want to follow up in writing if he prefers. The key recommendations of the Women of the North report are that central government should deliver a national health inequalities strategy, one which convenes government departments from across Whitehall to put health at the heart of all policies to address the wider determinants of health. Many of the policies announced in the budget, as well as the Employment Rights Bill, will be welcome, such as uprating universal credit in line with inflation and tackling zero-hour contracts. And of course, we wait in anticipation for the Child Poverty Task Force strategy next year, and I sincerely hope that we will see an end to the Tory two-child limit. In addition, the report recommends that the Treasury should consider targeted support for pregnant women as well as improving childcare. And when it comes to local and regional government, which I know the Minister has experience in, the report suggests targeted support delivered to 11 to 18-year-olds through careers hubs at areas of greatest deprivation, and for a higher level of the adult education budget for the North. Greater support is also required for women navigating the social security system, as well as supporting social security uptake. and increasing support for women to transition back to their families and integrate into their communities after they've had involvement in the criminal justice system. Finally, with health and social care, NHS England could provide additional support and investment for women's health hubs, and health services should be supported to collect routine data on ethnicity and other key demographic data to help deliver better information for service development and improve our understanding of different health needs, as well as explore the ways in which their work can be adapted to address health inequalities across different population groups, such as cultural sensitivity training, adopting a trauma-informed approach to care, and promoting person-centred approaches. Chair, I've been an MP since 2019 and I've spoken about health inequalities ever since I was elected. And of course, today's debate isn't pleasant, but I'm genuinely hopeful that we can turn a page under a Labour government. We've already seen positive measures like the Employment Rights Bill and measures in the budget, and I look forward to the Minister's reply, and I hope working with him alongside Health Equity North to deliver happiness and dignity for women in the North, which is long overdue. Thank you, Chair.
The question is, this House has considered inequalities faced by women in the North. Minister.
Thank you, Sir Christopher, and it's a pleasure to serve under your chairmanship. I'm also really grateful to be able to respond on behalf of the government to this vital discussion brought to the House today by my honourable friend, the member for the City of Durham, about the issues raised by the Women of the North report. This report highlights the challenges facing women across the northern regions of England. And I'm pleased that the government's Women's Health Ambassador, Professor Dame Leslie Regan, has been able to deliver a keynote speech at the Women of the North report launch in September, where she spoke about the importance of addressing the health inequalities faced by women living in the north of England. While the report brings into focus the striking health inequalities that women in the North contend with, our government is committed to addressing these regional inequalities head-on. Let me be clear up front that the conditions outlined in this report are unacceptable in a country as resourceful as ours. Women in the North face stark inequalities, not just in health, but as we've heard from my honourable friend, in economic security and social support. Our response must be to address these on multiple fronts, and that work, Sir Christopher, has already begun. Because we are committed to working across government to tackle wider inequalities that lead to poor health, focusing our health and care system on preventing ill health, shifting more care into the community, and intervening earlier in life to raise the healthiest generation of children in our country's history. We will improve healthy life expectancy for all, and we will halve the gap in healthy life expectancy between different regions in England. Now, this government is committed to prioritising women's health as we build an NHS that's fit for the future. And women's equality will be at the heart of our missions. We're considering how to take forward the women's health strategy developed by the last administration, but we want to align it to the government's missions and the forthcoming 10-year health plan. Now, this particular report is very timely. As my honourable friend has set out so powerfully, reducing inequalities must be a central focus in our strategy going forwards. We will carefully consider each of the report's recommendations as we do this, and I will make sure that ministers across government have sight of this report and consider those recommendations that relate to their own policy areas. My honourable friend mentioned women's health hubs, and these are going to be key to improving access to women's health services and reducing those inequalities we care so passionately about. The women's health hubs will be able to do this by providing a set of integrated women's health services in the community itself, centred on meeting women's needs across the life course. The department has invested £25 million over the last year and 24-25 to support the establishment of at least one pilot women's health hub in every integrated care system. Within the north of England, I'm pleased to say that integrated care systems are making good progress to set up their pilot hubs. For example, in northeastern North Cumbria, the funding is being used to set up 3 pilot hubs in Sunderland, Gateshead and North Cumbria, which have a strong focus on tackling inequalities and community outreach. My honourable friend also mentioned smoking, and this is a huge driver of inequalities in too many communities, particularly in the north of England, but not exclusively. And she is absolutely right, and I can confirm to her on the day that the Tobacco and Vapes Bill will receive its first reading in this House, that good quality smoking cessation services are and remain a big part of the jigsaw to getting a smoke-free UK. And financial incentives are working well. I can report that to her. I mentioned some of the wider social inequalities that underpin poorer health chances, as did indeed my honourable friend. I think it's shocking, Sir Christopher, that a woman in the north working full-time may earn £56 less per week than the national average, and £188 less than a woman in London. Every part of the country has a vital contribution to make to our country, to our economy, but too many areas have been held back because decisions are often taken here in Westminster and not by local leaders who understand the local ambitions and the strengths, the opportunities and the weaknesses and the threats to that local population. And that is why this new Labour government is committed to empowering local government, enabling them to pursue growth, create jobs and improve living standards with support from central resources. We will ensure that those places have the strong governance arrangements, the capacity and the capability to deliver, providing central support where needed. Additionally, as my right honourable friend, the Chancellor of the Exchequer, set out in our first budget last week, the national living wage will increase from £11.44 to £12.21 in next April. That marks one of the largest boosts since the creation of the national minimum wage in 1998, benefiting women who make up a significant proportion of minimum wage earners. Sir Christopher, if I can turn to mental health and domestic violence. The Women of the North report reveals stark challenges facing northern women, with rising rates of mental illness and domestic violence. And there are a number of important measures we have committed to taking to improve support for women, and we are already taking them across government. We are committed to an NHS that's responsive and accessible, with 8,500 new mental health workers to reduce waiting times and a specialist mental health professional in every school. Young Futures hubs in every community will also offer open access mental health support for young people, including girls. Recognising healthcare's role as a frontline for survivors, all NHS staff undertake mandatory safeguarding training, which includes a focus on domestic abuse. Furthermore, my department has published and disseminated a working definition of trauma-informed practice for health and care sector. and NHS integrated care boards enable provision of more integrated services for victims and survivors. The Victims and Prisoners Act 2024 also places a new legal duty on integrated care boards to work with local authorities and police and crime commissioners to join up the commissioning of victims' support services. Now, one of the most striking points raised in the report is the extraordinary burden of unpaid care on northern women. Women who give over 50 hours a week in care duties deserve our utmost respect and this government's support, and we are working to ensure they have it. Our recent increase in the earnings threshold for carers allowance will help 60,000 more carers to maintain work whilst receiving financial support. And for the first time, carers can now earn more without reducing hours due to minimum wage rises. This will bring much needed financial stability to carers, and it will allow them to retain their links to the labour market, which is absolutely crucial. We will continue to monitor and to respond to carers' needs, ensuring that they have the resources to support their families and their wider communities. Moving forward, we will continue to assess the needs of carers in the north and beyond to ensure that we are offering tangible, effective assistance to these unsung heroes. Now, in closing, Sir Christopher, I would like to put on the record that the government's commitment to our northern communities, and indeed to the women who drive them forward, is unwavering. We recognise that the strength of our nation rests on the health, on the security, and on the potential of all women, regardless of where they live. But we know, as Northern MPs, the stark inequalities that are far too prevalent in far too many parts of the regions that make up the north of England. And we want to ensure that we rebalance not only the health outcomes of women in the north of England, but the economic opportunities offered to women in the north of England too. Because it's not only a matter of justice, it is a matter of building a society that values every single woman's contribution equally and provides her with the means to thrive. So let me affirm that this government, and I as the Public Health and Prevention Minister, albeit a man, stand ready to support the women of the North and every woman in this country by addressing the entrenched inequalities that hold too many women back. Through our coordinated efforts across health, across economic policy and social care, the real benefits of a mission-led government that doesn't work in silos, Sir Christopher, but works across the whole of government to tackle the needs of the citizen, and in this case of women and women in the north, will pay dividends as we march towards that 10-year decade of national renewal that this country voted for on the 4th of July this year. So that coordinated effort across health, across economic policy, across social care, housing, planning, transport, the environment, all public policy, education, skills, training. We will work towards a future where all women, wherever they are in this country, but we're northerners, and this debate is about the north of England, so that those women can look forward to lives filled with good health, economic security, and the opportunity to achieve their potential. And I will leave you with just one thought, and that was my first day as the Public Health Minister. And the first presentation that I had, and I had lots of presentations to bring me up to speed on a whole range of policy areas, was on life expectancy. And it was a simple bar chart, Sir Christopher. 2 women. One who has the privilege of living in a less deprived part of England, and one who has the privilege of living, or has the misfortune of living in a more deprived part of England. And the life expectancy of the woman in the less deprived part of England was just shy of 80, 79.9 on average. For the other woman, it was 10 years shorn off her life, 70. But that was not the most shocking part of that graph, Sir Christopher, because those 2 bars were shaded in part in another colour, orange. And the orange signified the healthy life expectancy of those 2 women. And for the woman that lives to near 80, in the less deprived part of England, she falls into ill health at 75. So all of her working adult life is in good health and only falls into ill health in the final 5 years of her life. For that other woman who lives to 70, she falls into ill health at 52. Now that shocked me to the core, because these aren't statistics, these are people. These are people who I represent, who my honourable friend represents, and indeed there's inequalities across the whole country, and these are people that you too, Sir Christopher, represent. But for each person who is falling into ill health, with another 15 or 16 years of adult working age to go, that is a tragedy on a personal level, and it is the economics of the madhouse, because these people have potential, they have economic ability, they have hopes and dreams that are whipped away because of inequalities. And it is the duty of government to push that orange bar as close to retirement age as possible for those women, preferably into retirement age. And look, let's be ambitious, let's put sickness beyond death. But it is the duty of government to tackle those health inequalities. And I hope I assure the House, and indeed my honourable friend, that this is something that, while I'm in this ministerial post in this government, will be my #1 aim, to make sure that we live healthier, happier, longer lives. And here's to the women of the North.
The question is that this House has considered inequalities faced by women in the North. As many of the opinions say aye. The contrary no. I think the ayes have it. The ayes have it. Order, order. The sitting is suspended until 2:30 p.m.